I think there's been a general consensus that pharmacies are often overlooked as a source of care for those in the community. And I've visited many pharmacies in my constituency in Winchester, and there's Eric who runs Springvale Pharmacy up in Kingsworthy, there's Colden Common Pharmacy in Colden Common, the Wellbeing Pharmacy in the High Street, where they give me my flu jab every year and actually make having a flu jab a lot of fun. So we always have a great laugh, which I never thought having a vaccine would be something you'd look forward to, but I love going in and seeing them. And we know that the 8 a.m. rush for GP appointments, so the fact that there exists a high street service where one can drop in for advice and consultation is absolutely brilliant. And pharmacies allow us to siphon off some of these pressures on GP services. But as pharmacists have been telling me repeatedly since well before I got elected, pharmacies are currently under immense amounts of pressure. Now, this has been added to by the increase in national insurance contributions, which has saddled pharmacies and GP surgeries with additional cost. And as a consequence, many local pharmacies have had to limit opening times and staff numbers. So in Alresford, in my constituency, the hard-working staff at Wessex Pharmacy have had to close shop on a Saturday afternoon. And this service will be sorely missed, particularly for those who are in full-time education or those who work during the week, and so relied on the weekends to better pick up their prescriptions. And in addition to this, shorter opening times mean if a patient sees their GP later in the day, the required prescription is delayed by a day, and then the paperwork isn't registered in time, and then, when an urgent need of medication, there's an extra day that can be extremely frustrating and worryingly for the patient. And while we really do welcome the recent government increased funding to community pharmacies by 10%, that very is welcome. It's worth pointing out that it's giving of one hand and taking of the other. And in the wake of rising costs for energy, staff and medicines, this funding increase was the first in 10 years. So it's sorely needed, and unfortunately it did little to alleviate the extreme pressures heaped onto community pharmacies in the budget. And it comes into focus when we also consider the rise in drug costs, things like paracetamol and hay fever medications having risen by 20-30%, and an 11-fold rise in cancer drugs since February. The funding provided to community pharmacies has dropped by over 20% in real terms since 2015. Now, this is why we're calling on the government to invest in pharmacies in smaller towns, in particular in villages and rural areas like mine in the Meon Valley. There's places like Bishop's Walth and Colden Common where not only people need to be able to access a community pharmacy for convenience, but now it's becoming more vital. And the Conservative-run Hampshire County Council have cut vital bus services to the nearest big towns, which means that people who live without a vehicle, especially older people, absolutely rely on these local pharmacies to get the medication. We're also calling for a new long-term sustainable model for pharmacies of an expansion of Pharmacy First to give patients more accessible routine services so we can free up GPs' time. And we want an exemption for pharmacies from the national insurance contribution increase so that funds can be spent on patients and vital medications. But my final point, and I think this is key, is that I have spoken to many pharmacists since I was elected and before I was elected, had very long conversations with them and in-depth conversations. I've also attended events in Parliament organised by the Royal College of Pharmacy and the National Pharmaceutical Association about the NHS pharmacy contract and discussed with them their issues with this. Given my professional background, I'm used to sourcing drugs, dispensing them, prescribing them. The contract is so complicated, despite my extensive conversations with them, I don't fully understand this. And I think, but the key message that comes out is that it is costing pharmacists to dispense NHS medication in many cases. And it's also that this NHS medication is sometimes being subsidised by other sales within the shop. And I have even met 2 pharmacists who have said that their own personal finances are subsidising some NHS dispensing. And this is clearly not something that is tenable in the long run. Yes, I'll happily give way.
That standardisation and inconsistency around services is really, really important. I've got a person that lives in my constituency of Doncaster East in the Isle of Axholme who lives with poor mental health, and his pharmacy has stopped doing the nomads, and to travel to the next pharmacy where they actually don't pay for that is just too far for them. I just wonder if he agrees with me that consistency piece and how we support pharmacies is massively important going forwards to help people like my resident.
I completely agree. I thank the honourable member for that intervention. And all businesses need predictability and stability. And it appears that pharmacists are going week to week, trying to work out how to source drugs with changing prices, with an NHS contract that isn't meeting their needs. And it's so important to remember when we talk about community health care and community provision, having good, well-run pharmacies means people are being kept out of GP practices. It means people are less likely to turn up at A&E, which is actually even better value for money for the NHS and ultimately for the taxpayer. So there's no downside from a government point of view to investing and supporting heavily in community pharmacy, because the savings made upstream will be hugely significant. And at the moment we're treating people with conditions that should be treated in the community with the most expensive part of the NHS, like in A&E and in hospital, when they could quite possibly have avoided going there in the first place. I'll happily give away.
Just on that point, therefore accessibility is paramount. And actually the costs that are pushed onto pharmacists, which mean that they can't remain sustainable, means actually that they resist pharmacies opening in smaller places because it will take away business for them. So therefore those pressures take away from accessibility, which is needed.
That's another very legitimate point, and it was made in my second to last word, so I thank you for contributing, and I thank the Minister for listening to our concerns.